Hello, and welcome to Med Evidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loibal, and this week we are talking about trials in Japan aimed at regrowing teeth. Tooth regeneration sounds like a great idea. Playing a live music performance can be stressful, especially for someone who hasn't done it before. Years of practice can melt away before a crowd when it's the real deal. Even more, things can and will go wrong, throwing everything off and requiring correction. Dress rehearsals are a temporary run-through of the show with as much similarity to the live show as possible to help work out kinks and help alleviate those butterflies in the stomach. Our mouths do a similar performance. We have dress rehearsal baby teeth, which fall out to be replaced by our permanent adult teeth. Similar to how a broken instrument can cause problems during a live show, things can and do go wrong with our teeth. Just like with any performance, a stage manager and/or conductor are necessary to initiate and organize the symphony of growing teeth. The developing body has to balance a complex composition as it grows teeth. Teeth are highly specialized bones with specific crown shapes, growth directions, movement, and an extremely hard outer layer of enamel. In humans, the main organizers of tooth growth are a pair of protein classes called bone morphogenic protein, or BMP, and WNT. There are over 30 BMP molecules present in practically all tissues in the body. BMP signal proteins are critical to embryonic development, stem cell differentiation, and bone formation. In the mouth, BMP directs tooth shape and where the tooth will go. WNT proteins are like the sound engineer. They direct cell growth and patterns. In the mouth, WNT helps to initiate tooth buds, that's where the tooth formation starts, tooth shape, growth direction, and development of the protective enamel. At the end of the night, the show must come to a close. The dress rehearsal hopefully ironed out any problems, and we hope the live show went off without a hitch. In the body, the closing curtain for tooth development is uterine sensitization associated gene 1, or USAG1. This protein inhibits BMP and WNT after our last permanent teeth come in, telling them to stop producing teeth. The show is over. But, as anyone who has been to a battle of the bands knows, things frequently go wrong during the live show. Wisdom teeth can come in sideways, gaps or overlaps can form between teeth, genetic disorders can result in fewer teeth than normal, and of course people lose teeth to accidents or disease. Luckily, when we want the show to go on, we can sometimes convince the band to play an encore performance. When this happens, the curtain sweeps back open, the band steps back out, and they play a bluegrass rendition of Baby Shark or whatever. In the world of teeth, this has been a pie-in-the-sky dream, tooth regeneration. That dream has been inching closer to reality after discoveries in mice that suppressing USAG1 resulted in a third dentition. Mice with suppressed USAG1 had increased levels of BMP and WNT, which resulted in successful regeneration of teeth. In 2024, this moved from the lab to clinical trials at the Kyoto University Hospital in Japan, and the first in-human trials of USAG1 inhibiting medications began. These initial investigational trials are focused on evaluating medication safety, but subsequent trials will begin soon with the goal of restoring lost teeth and improving dental health and function. Investigations like this take a lot of time, and the earliest guess for limited approval of such medications in Japan would be by the year 2030. But if all goes well, people with tooth loss or genetic differences may be looking at a tooth comeback tour in the next 5 years. Thanks for joining us on this week's episode of Med Evidence Articles. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at medevidence.com and check out the Med Evidence podcast for discussions between physicians and subject matter experts. Med Evidence provides evidence-based information that empowers individuals to make informed health decisions. The organization stands apart in the presentation of unbiased clinical research in clear, accessible formats guided by medical experts. Med Evidence provides education for patients and healthcare professionals with a focus on research as a care option. Note that information provided in this podcast is for general educational, scientific, and informational purposes only and is not intended as and should not be treated as medical or other professional advice for any particular individual or individuals. If you are experiencing any medical issue or have any medical concerns, you should consult with a doctor or other medical professional. My name is Benton, and we'll catch you next week.